everybody, and welcome to my channel. If you are tuned in today, you are in for a treat. So, today we're going to talk about ethics and legal issues. Just in case you guys have not visited our Instagram homepage, it's at Tutor Me Nurse RN, and we're also on Facebook, Tutor Me Nurse, and you can also email us at tutormenurseassistant@gmail.com. On here, you can also tell us how we're doing when we are posting our content. We are glad to hear your feedback. And make sure you guys subscribe. So here we're trying to talk about some definitions, ethics versus morals. Let's know what is the difference between ethics versus morals. Ethics, it's more like a fact. It's what you can prove. And morals are traditions. So when we talk about traditions, we're going to implement family, culture, religion, different things like that, things that actually are passed down from ancestor to ancestor. All right, ethical principles. So here is a mnemonic that can help you remember your ethical principles. All new babies, just very fussy. A for autonomy. Autonomy distinguishes self-determination. So this is actually giving the patient or client some leeway and some insight on their own self so that they can make their own decisions. N for non-maleficence, which means do no harm. Our job in nursing is to absolutely do no harm to our patients. B is for beneficence, which means to do good. We want to make sure that everything that we do is in the best interest of all our patients. Justice, which indicates equal rights. So we treat one patient just the same as we will treat the next. Veracity indicates truth. We're going to always be honest with our patients. Infidelity implements promise. So when we make a promise to a patient, just make sure that we honor it. That's the most important thing to remember. Here are some examples of ethical principles. So the first one, delivering care to a patient with the diagnosis of AIDS, treating them the same way you would treat them if they had cancer. What type of ethical principle would this fall in? This is justice. So with justice, we have equal rights. So just because one patient has a diagnosis, we're going to treat them the same way as we would treat the patient that has an opposite diagnosis. Explaining to a cancer patient that chemo causes side effects but will aid in putting cancer into remission. This is an example of non-malfeasance. So when non-malfeasance, we want to do no harm. So we want to make sure that our patient is very knowledgeable of what the medication that they're taking or treatment that they're getting is going to do to their body, as well as how it will be in their best interest for curing their disease process or minimizing the effects of the disease. Nursing providing education material for a new diabetic is beneficence. So this means to do good. So if we have a patient who's a new diabetic and they want to get more information or gain more insight on their disease process, we want to provide them as much education as we possibly can. Being honest about side effects of medication is veracity. So that's being truthful. Making sure that the patient knows exactly what they're getting, exactly how it's going to affect their bodies. And fidelity. Returning aid to a patient's room when you have made a previous obligation to do so. So this is a promise. So if we tell a patient that we're going to do something, we want to make sure that we carry out those steps. Negligence versus malpractice. What are the similarities when it comes to negligence versus malpractice? Well, this is a conduct that falls below the standard of care, and it's also an unintentional tort. Some differences that we may note: negligence demonstrates potential harm. Malpractice occurs when a client is uninjured due to negligence. So those are the similarities and differences when it comes to malpractice and negligence. Here's a pop question. The charge nurse is being explained to a new grad the difference between negligence and malpractice. The new graduate nurse demonstrates understanding if she states that the difference is what? Negligence is an unintentional tort. Malpractice occurs in the hospital setting only. Malpractice occurs when injury happens, and majority of clients that experience negligence is in the middle age group. Answer here. C. Malpractice occurs when injury happens. Here are some examples of negligence, and of course there is more after this, but these are just a few examples just so that you can know off the bat. IV administration errors, medication administration errors, failure to give report, and failing to check proper usage of equipment. Good Samaritan laws. Laws that promote healthcare professionals to help or implement in emergent situations without possibility of a lawsuit. Now here's a side note. Immunity is only provided when healthcare professional receives zero compensation for care provided and the act is not intentionally neglect. Okay, so we have to remember that. If the act is not intentionally negligent, then the Good Samaritan law will apply. And also, the healthcare provider or the healthcare professional cannot receive any compensation for the care that is done. Legal risk areas. Assault is a threat. Battery, intentional touching of another person without consent. False imprisonment, preventing a client from leaving the healthcare facility without substantial reasoning. And that could be for a client that may have uh, dementia or some type of mental health complication. That does not apply to these clients. So with false imprisonment, this person has to be A&O times 3. They have to be their own spokesperson and advocate. They do not have anybody representing them, such as a DPOA and things of that nature. So we have to keep in mind when we look at false imprisonment. Defamation. We have two types of defamation. We have a written communication that damages a person's reputation, which is a libel, and a verbal communication that damages a reputation, which is a slander. Informed consent. Approval from a client to be touched by a specific individual. They must answer all questions prior to informed consent being signed. So when you are consenting in a client, you want to make sure that all the questions that the clients have, you must answer them before they sign that consent. Also, it must be witnessed by an adult without duress. So that means that they should not be threatened to sign this document. If client is under sedation or under influence or deemed incompetent, they are not allowed to sign the informed consent. Minors. Now there's a few things that comes against when we talk about minors, and one thing that you have to remember is the typical truth. The typical truth is that minors may not give legal consent. They must be given by a parent or legal guardian. But there is an exception to the truth. Several. One is that substance abuse treatment, they can give their own consent. STI, sexually transmitted infection treatment, they can give their own consent. HIV testing, they can give their own consent. Birth control services, pregnancy, mental health services, and being an emancipated minor, which is someone that has established independence outside of their parentals, can give informed consent. Advanced directives. We have two types of directives. We have instructional, which lists medical treatment that client chooses to omit or refuse if client becomes unable to make decisions and is terminally ill. So this would be something that is listed saying if they want to have CPR, full cold, or if they want to have just meds only, or if they want to have comfort measures, palliative care, that will be listed out as in the instructions. DPOA is a durable power of attorney, and that is a person who chooses to make healthcare decisions when a person is no longer able to. All right. This concludes our segment of ethics and legal issues. So until next time, please make sure you guys subscribe, click the button down below, make sure you turn those notifications on, follow us on every platform, Tutor Me Nurse RN on Instagram, Facebook, Tutor Me Nurse, and I will see you guys really soon.